As a palliative care doctor, fatigue is one of the most common symptoms I encounter. My patients often describe this as just not having enough energy to get through the day, or feeling wiped out all of the time. In this video, I will be discussing the common causes of fatigue in patients with cancer or advanced organ illnesses. Let's talk about it. Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Please see the welcome video of this channel for my declaration that I do not have any conflicts of interest or any financial sponsors, and for the medical legal disclaimer statements. I will leave a link in the description box below. In the setting of cancer or advanced organ illnesses, patients frequently describe feeling too tired to complete daily tasks in a sustainable way. Patients also describe being less able to start activities, or that their muscles don't feel strong enough to finish a task. At other times, patients often describe symptoms of brain fog, where they feel like their mind is operating in a slower gear. And despite resting or sleeping, these symptoms do not seem to get any better. Does this describe your experience or the experience of somebody you know? Feeling persistently tired or fatigued is one of the most common and most distressing symptoms affecting patients diagnosed with a cancer. But it's not just in patients with cancer. Fatigue is commonly seen in patients with advanced organ illnesses too. But here's where things can get tricky. You see, fatigue is a non-specific symptom. In this setting, fatigue can be caused by the presence of cancer or by the presence of the organ illness itself. But it can also be caused by a variety of different medical issues, either related to or as a consequence of having the illness. And to further complicate things, fatigue can be the main presenting feature of depression. So, how do we tell things apart? To be honest with you, it can be very difficult. And in many cases, fatigue is the end result of several things happening at the same time. Let's now talk about how, as a palliative care doctor, I would approach the different possible causes of fatigue. Let's divide the possible causes into three categories. Number one, more apparent causes, ones that do not require investigations in order to diagnose. Number two, causes that do typically require investigations or blood tests in order to diagnose. And number three, causes that are directly caused by the illness itself. Now, this discussion will not be an exhaustive list of causes, but more of an approach to thinking about the more commonly encountered causes of fatigue. Let's talk about the first category, more apparent causes. This is a broad group, but many of these causes can be assessed for without the need for blood tests or more invasive examinations. Let's start by talking about the treatments themselves. For example, tiredness and fatigue is a common symptom in patients undergoing chemotherapy and radiation treatments. This can occur during the treatments and potentially for days and even weeks afterwards. Another related cause is the energy required to get to and from these treatment appointments. Patients can often feel wiped out before the treatments even begin. Next up, side effects of medications. This list is very long, but the common culprits are anti-nauseants, antihistamines, medications used to treat depression and delirium, antibiotics, medications used to treat specific organ conditions, as well as medications used to treat pain. Now you may be thinking, That's a lot of different kinds of medications. And you would be correct. The tricky thing here is that a patient may tolerate one or two of these medications alone. But when we start layering several of these medications, one on top of the other, everybody is vulnerable to feeling more tired or fatigued. This is called polypharmacy. And for clarity, this is unintentional, but the reality is that multiple medications in combination can result in more drug-to-drug interactions and side effects. The next one, lifestyle factors. This is another tricky one, because some of these factors are unavoidable, such as housing issues, work and family scheduling, and the need to deal with unavoidable emotional stressors. Some lifestyle factors, though, can potentially be improved upon, such as poor sleep hygiene, dietary imbalance, and inactive lifestyle, or the overuse of non-prescription medications, such as caffeine, nicotine, and alcohol. Next up, symptom burden. This may be obvious, but it's still worth mentioning. The more symptoms a patient has, be it pain, nausea, constipation, and the more severe these symptoms are, the more likely the patient is going to experience fatigue. This is likely a product of the body needing to use more energy in order to cope with these symptoms. Finally, low mood, sadness, and clinical depression. Coping with challenging life events and medical illness can take a lot out of someone. Fatigue is a common finding here. Let's now talk about the second category, causes of fatigue that often do require investigations or blood tests in order to diagnose. Let's start with a common cause, infections. Sometimes the source of the infection is more clear-cut. For instance, respiratory infections that present with breathing troubles, such as worsening shortness of breath and a new cough. At other times, though, the source is less clear. For example, with urinary tract infections. In some patients, worsening tiredness or brain fog is the only symptom they present with. Next up, anemia, or low red blood cell counts. This is a very common cause of fatigue. Red blood cells are responsible for carrying oxygen to every part of our body. So if you don't have enough of these, your body is less able to keep up. Anemia has many different causes, but in this context, it is commonly caused by chemotherapies and medications, as well as caused by the illness itself, such as in cancers and chronic kidney failure or liver failure, to name only a few. Another common cause, changes to your electrolytes. There are many electrolyte abnormalities that can result in fatigue. This includes changes to sodium, potassium, calcium, and magnesium levels, to name only a few. The body's overall fluid balance can also have a profound effect on electrolyte abnormalities, both dehydration and fluid overload. Next up, body and organ functions. Impaired kidney and liver function can directly cause fatigue. As well, there are several endocrine and hormone-related causes that can also result in fatigue, such as poorly controlled diabetes and thyroid and adrenal gland-related conditions. In the context of an advanced cancer or organ illness, some of these described causes of fatigue can be temporarily corrected. More often than not, unfortunately, many of these abnormalities are not sustainably reversible. It's really dependent on what the actual root cause is. Let's now talk about the third category, the illness itself being the main cause of fatigue. The mechanisms are often invisible and cannot be found or quantified through blood tests or other investigations. In most cases, doctors need to rule out all the other common causes of fatigue before we can confidently say that the disease itself is the main cause of fatigue. It's a diagnosis of exclusion. Let's start with cancers. the presence of cancer has multiple effects on the body. In addition to it being physically in the way and taking up space, cancers can also produce their own chemical byproducts and hormones that can wreak havoc with the body's normal functioning and natural rhythms. The presence of cancer can also cause the body to produce inflammation-inducing cytokines that can directly cause fatigue. Unfortunately, we do not have a standardized way to look for some of these chemical changes, or a way to quantify them. It's an invisible process that is attracting researchers, but no easy fixes as of yet. As mentioned earlier in this video, fatigue can be a prominent feature in non-cancerous illnesses too. In congestive heart failure, the heart is unable to pump enough blood to keep up with the body's demands. This decreased blood flow can directly lead to tiredness. And with time, the overworked heart muscles get tired, resulting in generalized body fatigue. I like describing this scenario with a metaphor. A patient with heart failure is similar to a car with a small engine trying to pull a heavy cargo truck up a hill. Can it be done? Maybe, but not for very long. And in that time, you are working that small engine very hard. It's the same thing with heart failure. The workload is greater than what the heart can keep up with. And what the patient experiences is fatigue. In respiratory illnesses, such as advanced COPD and pulmonary fibrosis, we see a similar picture. The muscles around the lung and the diaphragm are working hard in order to deliver enough oxygen to the body and to rid the body of carbon dioxide. I often describe respiratory illnesses as feeling like running a marathon. Breathing hard causes muscles to fatigue. In kidney and liver failure, the accumulation of waste products and toxins in the blood can directly cause our bodies to feel fatigued. Furthermore, both of these conditions often result in anemia, making matters worse. There are likely other mechanisms at play too, such as abnormal neurotransmitter function. But those are invisible processes, and we currently do not have a standardized way to quantify them. In progressive neurological illnesses, such as Parkinson's disease, multiple sclerosis, or ALS, tiredness and fatigue can be a debilitating symptom. We do not fully understand the exact cause of it, but it's likely a combination of invisible factors such as nerve inflammation, abnormalities in neurotransmitter pathways, and muscle fatigue, to name only a few hypotheses. Fatigue is also a prominent symptom in patients with autoimmune illnesses, such as lupus or rheumatoid arthritis, as well as in patients with chronic infections, such as HIV. Why is that? Most likely related to the presence of chronic inflammation and inflammation-inducing cytokines. Furthermore, many of the medications and immunosuppressants used to treat autoimmune diseases and the antivirals used to treat HIV can directly cause tiredness and fatigue. To summarize this video, persistent tiredness or fatigue is a common symptom in patients diagnosed with cancers and advanced organ illnesses. Some causes of fatigue are more apparent, while others require investigations and blood tests in order to diagnose. The presence of cancer or the organ illness itself can also be a direct cause of fatigue. In reality, for many patients, it's a combination of causes that results in the overall picture of fatigue. I hope this overview is useful in helping you better understand the many causes of fatigue in this setting. Please stay tuned for part 2 of the series, where I will be discussing strategies and treatments that might help reduce fatigue in patients with cancer or advanced organ illnesses. Hope to see you then.